The V-Life with Dr. Annie is produced by Advanced Cardiovascular Care Center with educational grants from Amazing Lines, Dolce Vita Cardio Advanced Med Spa, and sponsored by In Mode Aesthetic Solutions.
Welcome to Live the V-Life with Dr. Annie. Today I'm going to talk about stress echocardiography, a wonderful modality that is not invasive, easy to do, and very quick in defining if a patient has problems with their coronary arteries. Stress echocardiography has been really equivalent in sensitivity and specificity with even nuclear stress testing over the years. And many places that don't have the availability of nuclear stress testing can do stress echocardiography. So let me talk about that. What does it involve? Treadmill testing is initially performed after we obtain baseline echocardiogram images. So an echocardiogram is basically ultrasound imaging of the heart. Easy to do again, placing a gel on the chest and a probe and obtaining images of the heart at rest. Then we have the patient walk on a treadmill using certain protocols, and some people who cannot walk very efficiently, we can actually modify those protocols. So don't worry if you can't walk very fast or for very long. We actually need the heart rate to come up to a certain amount, about 85% of maximum heart rate that one could obtain. And after that, we want to walk as much as we can, but then easily get off that treadmill and quickly get another set of images looking at the heart function after the patient has been stressed. That's why it's called a stress echocardiogram. And then we compare the resting images to the stress images. Now, how is that important? Very easy. If in resting images there are changes in how the walls move, the walls of the heart, of the left ventricle in particular, then that means there's a problem with the blood flow to that area. Remember, the coronary arteries are three major coronary arteries and their branches. So we can tell if there's a problem in the lateral part of the heart. Maybe the artery that's feeding that lateral part is having a problem. So we look at wall motion in particular. The patient has really no discomfort except with walking on that treadmill perhaps, but otherwise the test is very easy to do, obtaining echocardiogram images in rest and then in stress. And we take one more set of pictures about 2 or 3 minutes after that initial rest picture. The initial stress picture, and then we compare all those images. The patient can quickly know right then if they have a problem, and as I'm doing the test on the patient, I can tell them either that the heart looks normal with cardiovascular function being normal with stress, or if there's a problem, we can let the patient know if they need to have angiography, which would be one of the next steps that we can entertain to look at the coronary anatomy. So stress echocardiogram, easy to do and available in most centers where diagnostic ultrasound is available for the heart. So come see me for your stress echo. It's a great test.
The V-Life with Dr. Annie is produced by Advanced Cardiovascular Care Center with educational grants from Amazing Lines, Dolce Vita Cardio Advanced Med Spa, and sponsored by In Mode Aesthetic Solutions.